A warm welcome to the annual Stroke Summit 2021. We are honored to have you as our audience and witness this insightful event that aims to raise awareness of stroke science and amplify the benefits of timely access to emergency medical care. We all know how important time is. When someone has a stroke, every second that goes by is crucial. As brain tissue and millions of neurons begin to fade away, time could not be more precious. And hence, this year's theme for World Stroke Day is based on the importance of time. So without further ado, let's dive straight into our event, beginning with stroke can happen to anyone at any time. Stroke treatment is needed immediately to lower the chances of brain damage, disability, or even death. Hence, knowledge of stroke symptoms is vital to spot a stroke. Let us hear a bit more about how to spot stroke and what to do when from Dr. Bindumenon, Senior Consultant Neurologist, Apollo Specialty Hospitals, Nellore.
Stroke is a medical emergency. Symptoms of stroke happen suddenly, and it is important to recognize the warning signs of stroke. The symptoms of stroke depend upon the area of the brain that is damaged while the person is getting affected by the stroke. Now, what is stroke? Stroke happens when the blood vessel to the brain is suddenly blocked, making the cells to get damaged at that area, or the blood vessel in the brain suddenly bursts and the blood clot forms. The first type of stroke is called the ischemic stroke, and the second type of stroke is called the hemorrhagic stroke. Both the strokes are different in the treatment and the prognosis as well. Every minute counts. Time is brain, because every minute that the patient has developed a stroke symptom and he is not taken to the hospital and the treatment is not instituted to him, every minute billions of cells are being damaged, and sometimes these damage can be irreversible. It is very important for us to so recognize and spot the warning signs of stroke and responding to the symptoms of stroke fast. For this, an acronym for recognizing the symptoms of stroke, that is FAST, has been devised, that is FAST. Each letter stands for one symptom of the stroke. F is for face. When a person talks, suddenly, if the face droops to one side, or there is a facial deviation, for that matter, when we talk, there is a nasolabial fold. These two folds are equal on both the sides. If suddenly when a person is talking, the face goes on to one side, this could be a sign of stroke. Second A in the FAST acronym is arm, in which the person has a weakness of the arm, or for that matter, that same side of the same side leg. If there is, all these symptoms will be very minimal in the earlier period, so that it is very important to recognize and catch those symptoms. So if a person has a weakness of the arm, the person can just extend his arm in this way, and if the hand keeps falling like this, the person could be having symptom of stroke. For the leg, the person could be dragging while he is walking. Suddenly, they may feel that his feet is not able to lift from the ground, or the slipper is slipping off suddenly. So that is A in the FAST acronym. Third is S, is speech. Now speech, there could be three types. One is the person might suddenly stop talking. He may stop responding, and he may just look at you. He may look alert and awake, but he may stop talking. Or sometimes when he talks in a confused manner. He talks in a manner which is unrelated to it, or he may talk excessively, again unrelated. Or he may, when he talks, his speech would be not clear to you, though the words and the sentences are well formed, but you will take a lot of time to understand. That is S for speech. And the last is T, time. As I said, time is brain. Every minute counts. So you need to rush to the hospital immediately, the emergency services immediately. Apart from the FAS in the FAST acronym, There are other symptoms also which are for stroke. One is sudden unsteadiness of gait, unable to walk. While the person is walking, tends to sway to either side. When he's trying to hold something or catch something, trying to drink a glass of water, he tends to sway. That is unsteadiness. Visual disturbances, which could be in the form of double vision. That is, when he's seeing an object, it looks double. Or he has sudden blindness, not able to see anything. Or he just has one side of the visual field he is not able to see. Or he has sudden, severe, once in a lifetime, never experienced before headache. Or he can have sudden difficulty in swallowing as well. So any of these symptoms, that is FAS, unsteadiness, visual disturbance, sudden severe headache and difficulty in swallowing, if they are sudden in nature, the patient could be having symptoms of stroke. In some cases, any of these symptoms can happen to the patient and they might recover on their own. In these cases also, if these symptoms are falling under these terminologies, it is important that the patient again be taken to the hospital immediately, because they are known as mini strokes or transient ischemic attack. These are warning signs, and these are the symptoms that the patient has, so that the patient's symptoms can be addressed and treated properly, so that his chances of developing a major stroke can be prevented to a very large extent. Having spotted the symptoms and signs of stroke, what should you do? It is very important that we rush to the emergency immediately. Which hospital one should go to? It is important again. One should go to the hospital which has stroke treatment in place, that is a stroke ready hospital, that is a hospital with emergency services, a CT scan, MRI and a neurologist and the team of the stroke available. One should not go to the outpatient departments. We have our OPDs everywhere. One should not go to the outpatient department at this point of time, because as I said, we are working on the time window where within 4.5 hours of the time when the patient comes to the hospital, the golden window hour period, the patient can be given a thrombolytic therapy, that is a clot busting therapy, where the blood vessel, if it is blocked, the patient can be relieved of the stroke symptoms in a large extent of patients at that point of time, or when the patient is seen at 3 months period, the patient has a better chances of recovery and rehabilitation process is better in these patients. So go to the emergency services immediately where there is a stroke treatment in place. You need to go to the hospital fast, so that it is essential that either you use the ambulance services, especially in cities where the traffic is very bad and your own vehicle would take a lot of time to reach to the hospital. So you need to take the emergency services very fast. So you need to take an ambulance which can reach the hospital immediately. Please do not give anything by mouth to the patient, because when the patient has developed a stroke, the patient would have difficulty in swallowing, he may choke, and then all the eatable particles can go into the lungs and create more problems, can develop a pneumonia, and that would be difficult. Do not give a patient the antihypertensive, that is a BP tablet, until and unless a doctor has advised him to give it under supervision, but rush to the hospital immediately. It is very essential that the person reaches in the time window, that is a golden window period of stroke treatment, and that is 4.5 hours. 4.5 hours is when the patient reaches in the hospital and the treatment can be given, but so that one should reach the hospital well within the 4.5 hours period, because when the patient reaches the emergency, to the needle, that is the patient can be given the clot busting, that is the thrombolytic therapy, tissue plasminogen activator. It is 1 hour. This period for the patient to be evaluated with the blood investigations, history, his deficit and his imaging features, talking to the relatives, takes us almost an hour, let us say. So immediate rushing to the hospital as soon as you find the warning signs of stroke are important. Do not give anything by mouth unless the patient has been. Keep the records in place and note the time when the patient had developed these symptoms, because it is very important for us and note the presenting symptoms so that it will be helpful for the emergency doctor to see whether the symptoms have progressed. Recognize the symptoms of stroke, see the warning signs, spot the warning signs, and respond fast and respond immediately to the proper hospital where a clot-busting therapy, that is a thrombolytic therapy, can be instituted. Thank you.
Thank you, Dr. Bindu, for sharing your knowledge and expertise.